Today, I'm going to review the medication Valium and fill you in on 5 must-know facts so you can be better informed when deciding whether or not to start this medication. But before we get started, I need to quickly cover something that pops up all the time in the clinic, and it's super confusing to a lot of patients I treat, and that's that this medication goes by 2 different names. Diazepam is the generic name, and Valium is a brand name. And what you'll see is that providers will use these names interchangeably when talking about this medication, so don't get confused. Fact number 1 about Valium is that this medication is FDA approved for a whole lot of different things. For starters, it's often used in the management of anxiety disorders, and for the short-term relief of the various symptoms of anxiety. It can also be used in acute alcohol withdrawal, and is often very helpful in providing symptomatic relief from things such as acute agitation, tremors, delirium tremens, and hallucinations. Valium is also used to treat skeletal muscle spasms due to reflex spasms to local pathology, spasticity caused by upper motor neuron disorders, athetosis, and Stillman syndrome. Then on top of that, it's also used as a helper medication for seizures. So fact number 2 that I want you to know about is how this medication works. Valium is in the benzodiazepine family, and at a basic level, it works by enhancing the inhibitory effects of GABA in certain areas of the brain that are often too excitable. And when we're talking about anxiety in particular, it's thought that these inhibitory effects occur in the amygdala, which is considered to be the fear circuit of the brain. So the more active the amygdala, the more anxiety and panic we're going to experience. And Valium works to dampen this overdrive in your brain to help calm it down. And then when we're talking about seizures or spasms, it also has inhibitory actions in the cerebral cortex and in the spinal cord. Fact number 3 to know about is how this medication is prescribed. So Valium comes in many different forms. There's tablets, liquids, injectables, and rectal gels. This is actually the only benzodiazepine with a formulation specifically for rectal administration and is one of the few available in oral and injectable forms, so it's pretty versatile. So I'm just going to discuss the oral forms since these are the forms that are most often prescribed in the outpatient setting. So when taking this for anxiety, muscle spasms, or seizures, the dosing is generally between 2 to 10 milligrams 2 to 4 times per day. The max dose is 40 milligrams per day in divided doses, and the goal is to always find the lowest effective dose and use it for the shortest duration as possible. Then something else to keep in mind is that the liquid formulation should be mixed with water, fruit juice, applesauce, or pudding. Now, a question that I'm frequently asked is how long does it take for this medication to start working? So something that makes Valium one of my favorite benzodiazepines is that it has a fast onset of action in addition to a long duration of action. So you get a lot of benefit up front that persists throughout the day, right? It's not like Xanax, which is quick in and quick out and then leads to a ton of rebound anxiety afterwards. The oral form of Valium is quickly absorbed, and patients tell me that it typically starts working within 15 minutes. And on average, it reaches peak concentrations within about 1 to 1.5 hours. So something to be aware of is that when taking this medication with food, it can affect how it's absorbed. So a moderately fat meal can delay and decrease its absorption. And generally, it's thought that lag times are around 45 minutes when taken with a meal, compared to about 15 minutes when fasting. And then the half-life of this medication is around 100 hours, which gives it a nice long duration of action. Fact number 4 that I want you to be aware of are the side effects of this medication. So according to the FDA label, the most commonly reported side effects include drowsiness, fatigue, muscle weakness, and ataxia, which is essentially the loss of control of your body movements. Now, there are some big hitter side effects with benzodiazepines that I need you to be aware of, and these medications can 1. Cause respiratory depression, and this risk is increased if you're taking more medication than prescribed, or if you're taking opioid medications in addition to your benzodiazepines. Studies have shown that using opioids with benzodiazepines increases the risk of drug-related mortality, so we're talking about death here. 2. Increases the risk of congenital malformations during pregnancy. So Valium has been associated with neonatal flaccidity, respiratory and feeding difficulties, and hypothermia. In addition, there's also the risk of the baby experiencing withdrawal symptoms. And remember, Valium is in the FDA pregnancy category D, meaning that human studies have shown fetal risk. 3. Interfere with cognitive and motor performance. So be careful when considering whether or not you should drive after taking these medications. They can lead to impairments and you can get a DUI or DWI if you were to be pulled over. 4. Lead to suicidal behavior and ideation. So it's been estimated that Valium may cause suicidal thoughts or actions in about 1 out of 500 people. And then number 5, they can cause dependence, tolerance, and withdrawal. Remember, benzodiazepines are scheduled for controlled substances, and drug abuse and dependence is a serious risk, especially in those who are using these medications long-term and are on high doses. And so remember, the FDA label itself states that it is not known if Valium is safe and effective for use for longer than 4 months. So again, the goal is to use these medications for the shortest duration as possible. Now, fact number 5 that I want you to know about is that Valium should be gradually tapered and discontinued. The reason behind this is that coming off the medication too quickly, especially if you're someone who has been on high doses for long periods of time, puts you at increased risk for withdrawal symptoms. So mild symptoms of withdrawal can include things such as diarrhea, muscle cramping and twitching, decreased appetite, blurred vision, clouded sensorium, and a heightened sense of perception. However, the biggest thing that you need to know about is that abrupt discontinuation or rapid dosage reduction can produce seizures and life-threatening withdrawal reactions. So we need to taper this medication very slowly. So my approach is typically to decrease the dose by at most 2 milligrams every few days. However, I've had times where I've gone as little as 0.5 milligrams every couple of weeks in patients who have had more difficulties with tolerability. Some patients even require a slower taper over a much longer period of time, so it's very much based on the individual and their tolerability. Now, if you're looking to learn more about other benzodiazepines out there, make sure to click that top video.